My name is Zilpher A. Kepher. I'm the Executive Director for the Partnership for HIV-Free Generation. HIV-Free Generation is a local organization that is registered in Kenya. We work at the national level and also at the county level. Our vision is to have a healthy, productive generation free of HIV. And our mission is to inspire young people to be able to reach their potential using evidence-based interventions and partnership. Our thematic areas include HIV prevention and response, TB programming, sexual reproductive health, gender-based violence, prevention and response, economic empowerment and education. We target adolescents and youth aged between 9 and 24 years in Kenya. SASA is an acronym meaning Start, Awareness, Support, Action. It is an evidence-based curriculum that is used to bring about positive change in the community in relation to gender-based violence, prevention and response. It was important to implement SASA project in Kilifi because Kilifi County is one of those that have got high prevalence of teenage pregnancies and also gender-based violence. And because of that, it was important that then we work with the community to bring about change and ensure that then adolescent girls and young women get their rights. Many times you find that these adolescent girls and young women may not even have sanitary towels to use during their menstruation. So what happens, people can be able to take advantage of them in the name of giving, some little money to be able to buy those sanitary towels. Again, some children or some families go without food. And I think really when they get people who can be able to, buy them some little chips here and there, then you find that then they succumb and they take advantage of them. So poverty is really a real issue that we need to think about economic empowerment for the communities that we're working with so that they can be able to be independent on their own. People should not be able to take advantage of them. We've been able to work with adolescent girls and young women, particularly to provide training on life skills, training on GBV prevention, and training on their rights for them to know that yes, they need to stand for their rights and no one should take advantage of them. In the past, they would be shy, they would not be able to talk about issues, especially sensitive issues on sexual reproductive health. But we've been able to talk to them, we've been able to train them, we've been able to hold a lot of sessions with them where we're supporting them for them to know their self-esteem, to know that it is their right to be able to speak out on issues about gender-based violence. And no one should be able to intimidate them. They have a right, as much as they're young people, they have a right to be able to speak out. And they know the power, the power that they have within them to be able to speak. And they know the power they have as a group. They can come together as a group of young girls and adolescent women to be able to speak for their own rights. We've been able to engage males to participate in the project, and they've been trained as male champions. We even have older people, younger people who we use as facilitators to sensitize the community on gender-based violence, prevention and response. And I would particularly like to thank the Kaya elder in Rabai, who has really been at the forefront championing the rights of adolescent girls and young women to ensure that they are not abused. We've also been able to work with the local gender committee that has really been able to do a very good job in ensuring that then they respond to the gender-based violence cases in the community. We were able to support Rabai Sub-County Hospital with the post-rape care kits. About 100 of them. They didn't have ways of preserving evidence of rape cases from the community. So we're able to respond and support them with the kits, and we're also able to train them on how to use the kits and also how to respond to gender-based violence clinically from the community. It may not be so obvious because we've hardly been 1 year implementing this project, and for us to see a very good impact, you need to be in a community for like over 5 years to be able to measure the impact. So I would want to say that yes, this was just like initiation phase of the project, and would like to request our donor, the Amplify Change, because of the positive outcome. The people really like the project, they are participating in the project. And of course, we have got some of the survivors of gender-based violence who have been able to come out and share their experiences. For us to get very good measure the impact of the project, we need to be there longer, and therefore request the Amplify Change to consider giving us more funding to continue with the good work in Kilifi County. Some of the challenges we've encountered in implementation of the project, initially when we came in, there was a lot of community expectations. They expected us to provide finances and give them money, sitting allowances, and we explained to them that really we've come to support them to reduce gender-based violence in the community, and we sensitize them that that is not how to sustainably implement a project. So we were able to sensitize them and tell them the aim of the project and how we are working, and brought them on board really to also support us in overseeing the project implementation, and therefore we were able to navigate that. Poverty levels in Kilifi is a bit high, and in as much as yes, we are mobilizing communities, we are sensitizing them on gender-based violence, but still without economic empowerment, it becomes a bit difficult for us to realize our goal. So going forward, we would like to either partner with organizations that would empower the communities economically, or look for funding that can also be able to support these young people, especially the teenage girls who have dropped out of schools, teenage girls, married adolescents. They need to have some source of income that can be able to support them. So I would say that is really a major challenge that we need to address as a community, as the donor community, and even as the county government. One of the challenges is in relation to access to justice. For instance, there's a case whereby there's a girl who was raped, and of course the local gender advisory committee were able to report to the police. But later on, the parents came and said they've decided they want to sort out this on their own at home, and we don't have to continue with the case. So really, that's a big challenge, because again, when the parents come and they insist they want this sorted out of the court, and they convince their daughter that this has to be sorted out of the court, then it becomes a bit difficult for us to pursue the case. We'd like to thank Amplify Change for strengthening HFG's capacity. They supported the development of the strategic plan that is currently on up to the year 2025. They've also been able to support us purchase a new financial software that we're currently rolling out. They also built our capacity, especially for our staff, in advocacy on sexual reproductive health rights, and also managed to support us review our policies, and came up with a whistleblower policy that then would go a long way for people to respond to issues of fraud and even gender-based violence cases in the community. So we thank them so much, because they're flexible and they're cognizant that local organizations also need to grow. We also want to appreciate the county government of Kilifi and the general community and the key stakeholders we've been able to work with. Particularly the Rabai Health Sub-County has been really very instrumental, and I would want to appreciate the clinical officer, the facility in charges, and the entire team for giving us a very good time working together and supporting the community. It will take the entire community, the key stakeholders to come together to be able to respond effectively in GBV prevention and response. I'm talking about the community generally. We are talking about usually the negative norms that happen, early marriage, men taking advantage of young girls, people in position taking advantage of vulnerable communities. We need to be able to work together as a team. We need to engage the males to become male champions, to be able to be at the forefront. We have to work with the service providers who can be able to respond to GBV cases, especially the Ministry of Health and the other healthcare providers in the community. We also need to work with the law enforcement officers, and that is the police, to be able to effectively respond to the GBV cases. And we can't forget about the county government, including the provincial administration, that really works hard to ensure that then we effectively respond to the gender-based violence cases.